Welcome back to this week's episode of the Delivered Podcast. I'm your host, Athena Estelle. And on this week's episode, we are joined by a fantastic, very knowledgeable, and professional mental health counselor. Her name is Lauren, and I am just so thankful for her time and that she's decided to join us today. Welcome, Lauren.
Good morning.
Yes, I'm so glad that you're here. So, Lauren, for the listeners, just go ahead and give them your background, your experience. How long have you been a mental health counselor?
Okay. I've been licensed since 2018. So I've been practicing for the past 6 years, started in different levels of care, started inpatient, worked my way to outpatient, and now I'm doing private practice.
Awesome. So, in those specific fields, you're currently in private practice. I know that the practice that you're with specializes in a technique called EMDR.
That's correct.
Yeah. So, for the listeners that don't know what that is, can you give us like an explanation of what EMDR is and the type of patients that you've seen success with that?
So EMDR is an acronym for eye movement desensitization and reprocessing. So you can tell, or you can see why we keep it shortened down to EMDR. EMDR is a therapy intervention that was started by a psychologist by the name of Francine Shapiro back in the day, so back in the 80s. And it initially started with eye movement. So if you were to ever Google EMDR or look it up on YouTube, typically you're going to see the eye movement piece, but what they have found is any type of bilateral stimulation, whether that's eye movements, tapping, sounds, can help us to light up two parts of our brain, our thinking part of our brain and our feeling part of our brain. And can actually, which is called dual attention, and can help us to process our memory. So if you think about EMDR as having one foot in the past and one foot in the present. So that bilateral stimulation, whether that's the eye movements where you see someone's eyes going left, right, or the tapping from, one side of your body to the next, that helps us to light up both of those parts of our brains and incorporate more rational thinking to our trauma, so to those memories. So when trauma occurs, often our central nervous system becomes extremely dysregulated to the point where most of us are in fight or flight mode. Once we're in fight or flight mode, our prefrontal cortex, which is in the very front of our brain, shuts down. So that rational thinking piece shuts down, and what you're left with are memories that are left in a very emotional state. That's why we have triggers. So that's why you can be driving along the road, 20 years after a memory and get triggered. So what we do is think of it as sprinkling a little bit more rational thinking to a memory. A lot of people ask, well, is it going to eliminate a memory? No. So the purpose of EMDR is not to eliminate a memory. The purpose is to make the memory less disturbing. And we do that in two parts. So the first main part is the desensitization part. That's where we take that memory and we process it until there's no more emotional disturbance associated with that memory. Then the second main part of EMDR is called install. So installation. We install a healthier perspective or a healthier outlook to that memory. So we're not only decreasing the disturbance, but we're also increasing a healthier outlook. And that's usually done with belief systems. So, a memory can be very traumatic to us in the present, even though it occurred 20 years ago, because we might be telling ourselves, oh, I should have done more. So that's the link that makes it so difficult. That is the trigger. So we really take that down and essentially eliminate that negative belief or get it down to a more manageable level. And then we install something healthier, such as I did the best I could, for example. So by doing that, we're not eliminating memory, but we're allowing patients to move on with their life.
Mm-hmm. Yeah, that's powerful. So, if you're able to say, what type of patients is this EMDR able to really help change their mental space?
Well, the great thing about EMDR is that it's really appropriate for all different individuals with all different diagnoses. I tend to see trauma patients, but EMDR is appropriate for addiction, OCD. It's even implemented in couples counseling. And so if any of you out there have trauma, EMDR is an appropriate intervention for you. If you think about the experiences associated with addiction, with OCD, even it can be used for depression, anxiety. It is really an appropriate intervention for a lot of people, even psychosis. They've seen success in patients that struggle with psychosis.
That's powerful. I mean, I think that's awesome. So even if it's not a very extreme type of PTSD, any type of trauma, really, whether an accident or an injury or postpartum, all of those different things, I think that's great.
Mm-hmm.
Now, for people that don't live in Florida, is there an EMDR website that they can go through to find a practitioner, or is it something that is more word of mouth? How would a patient normally find EMDR?
That is a great question. So there's a couple of different ways. The first thing is there is an EMDR International Association website, and I'm going to give that to your listeners. It is EM as in Mary DRIA.org. This website, if you're thinking about getting involved in EMDR, finding a therapist, or just learning more about EMDR, check out that website. It has so much information. It also has a list of certified clinicians and can really help answer a lot of your questions. Also, another resource is psychologytoday.com. Wherever you are in the United States, you can plug in your zip code and it can populate therapists, and you can I believe you can filter through the interventions piece, and it will populate the clinicians in your area that can do EMDR.
Okay. Now, when you're doing the EMDR, I guess as like a broad picture, is the extent of the treatment and how long it lasts, is that just based on a case-by-case basis and exactly what that client is going through personally? Or is there normally a set program and it's a certain amount of weeks? Or how does that piece work?
That's a great question. And a lot of people do ask that. They've been dealing with trauma long enough and they kind of get to the point of, hey, let's move through this and heal. And how long is this going to take me? And yes, you're right. It is a case-by-case situation depending upon the person's trauma or depending upon what you're utilizing EMDR for.
Mm-hmm.
So if you're dealing with complex PTSD, it's going to be a longer process. If you're coming in for a single incident event, then that's going to take a much shorter time. But I would say on average for EMDR, what you can expect is the first phase is treatment planning. So when you first decide you're going to get EMDR, you're going to find a therapist, you find the therapist, you're in the first session, you're going to be doing the treatment planning first. That can take 1 to 2 sessions. And that is where you and your therapist work as a team to determine what it is that's disturbing, what you want to work on. And again, that can take 1 to 2 sessions depending upon what needs to be processed. The second phase is resourcing. That is when the clinician is going to give you some tools to use in the session and out of the session. And so the therapist is going to assess your level of coping in general during the treatment planning process. And in the phase 2 resourcing phase, you're going to be learning different techniques such as a safe, calm place or the container exercise, also resourcing role models, things like that. So that's where the therapist is going to bolster your toolbox, to give you all the things that you need to be successful in the process. On average, you can expect anywhere from, I would say, 3 to 10 sessions per memory, I would say on average. Some are going to be shorter. It just depends on, again, what we're targeting. And now, in terms of EMDR versus other interventions, like just your standard talk therapy, EMDR is very efficient. So if you think about a tree with roots and stems and leaves, EMDR is getting to the root of the issue. So in terms of efficiency, we go right for it. We also go back to the earliest point in time that we can identify that same level of disturbance or that same negative belief, and we work that piece. So not necessarily with the leaves, but actually in the roots, the stuff that's underground that we don't see. So the final stage of EMDR is phase 8. And that's basically once you're done with a memory, you come back in and the therapist makes sure that this memory is no longer disturbing. In terms of efficiency, so we get to the root of the matter for the individual, and there's a process in EMDR called overgeneralization, where if once we get to the root of something, it can actually help eliminate a lot of the things on our treatment plan to process. So it can almost like wipe it out, if you will. So if we get to the root, we can eliminate a lot of the things that might otherwise be on that list that are more current and things like that. So it's very efficient, and a lot of people love that aspect of EMDR.
Yeah. So I want you to be honest, and maybe I had a different experience, but I felt like I did do EMDR for a little while, not very long. But I wonder, when you have people that are going through that in the beginning stages, I think I was in stage 1, stage 2, does it ever happen where you see it dredges up a lot of emotion in them for those memories that are, obviously for me, mine was my daughter's weight gain and lack of weight gain and the helmet and the torticollis and the insomnia. I mean, I was dealing with a lot of different things, but I felt like when I could tap into those memories and try to release them and work on the container exercise, like you mentioned, I felt like in certain sessions, I mean, I was just a mess. Do you see that emotional response at times?
We can, absolutely. We can. There is a concept of window of tolerance within EMDR where you want to make sure each individual is within that window of tolerance while we're doing EMDR. So the clinician will help the individual stay regulated through that process. But absolutely, especially afterwards, the clinician is not going to let you leave their office dysregulated. You will walk out of that clinician's office just how you walked in. But the drive home from the office and things, or from your session and the subsequent days following that, yes, it can bring up a lot of emotion. That's normal. So after an EMDR session, the individual typically will continue to process, that night and the following 24 hours. And that's all normal. And that's where the resourcing comes in. That's why it's so important that the clinician assess the individual for readiness. So a lot of people want to do EMDR, and I will say that support goes a long way. You want to make sure you've got your basic needs. You want to make sure the individual is stable so that when we do access these memories, that individual has every tool in that toolkit possible to go through all of that processing that's following the sessions or in between sessions.
Yeah, that's great advice. I love that. Now, for the listeners that don't know a lot about EMDR and the things that you mentioned, can you give some insight into that container exercise that you mentioned? Or is that something that is more in depth that they'll learn in EMDR?
Well, both, but I can most definitely speak on it. So the container exercise is something that is a popular coping strategy or resource, as we call it in EMDR. And think about it almost as your permission to not think about things. The container exercise can be used at the end of every session, where it's a good tool to use to, the sessions are typically anywhere between 60 to 90 minutes. So we can only cover so much. So at a certain point, there are going to be things that we didn't get to. And the container exercise is a great place for the individual to kind of mentally put those loose ends. So it's a great wrap-up tool. Again, it's all about letting your individual get back to a place of homeostasis before they leave. It's also great in between sessions. So the container exercise, you can use it. Let's say, for example, you are in a meeting at work and all of a sudden something pops up in your head. You notice it's distracting you and it's pulling you away from the meeting. Put it in the container. So the container is a tool for your healing. And it is something that you can determine when you take things out of it. It's a great way to compartmentalize. It's like your permission to not deal with something out, in between sessions, which is important because you want to make sure that that individual feels empowered to manage their own symptoms, manage those intrusive thoughts, and gives them an opportunity to save it for the therapy session. Bring it out when you're ready in the therapy sessions. And again, with trauma individuals, empowerment is key.
Yeah, I love that. That's very powerful. Now, do you see, when you're doing EMDR, do you see any postpartum moms, or I guess maybe patients that have children that maybe had certain trauma in order to get to their children? What's your experience with that?
Absolutely. Yeah, absolutely. Child loss.
Mm-hmm.
That is a big thing. Also, even the, infertility, trying to get pregnant, postpartum. You have this new baby. Everything in your life is changed in a second. Yeah, I would say that the clients that I've typically seen postpartum are ones that are struggling with infertility, miscarriages, even infidelity during pregnancy, after pregnancy, anything, just struggling with getting back to a routine, struggling with grieving their old life prior to the child.
Mm-hmm.
Yeah, all of that are some of the things that I've seen in my practice.
That's great insight. Thank you. So you mentioned the IMDR website. Is there any other, I guess, resources or tools that you would give, say, your postpartum clientele or your infant loss clientele in that realm of mental health? Is there any type of resources that you like to refer them to?
I do. In terms of resources, one of the biggest things that I will tell my clients who are struggling with postpartum depression, struggling with anxiety, is polyvagal theory and polyvagal exercises, to be precise. So when you're postpartum, some people are breastfeeding, some people are not. There's concern for medications. Oh, I'm really anxious, or I'm just really struggling and I don't want to take medication. Polyvagal exercises are an excellent tool. So polyvagal theory is a theory based off of a gentleman by the name of Porges, and he really studied cranial nerves. So we have 12 cranial nerves. Your vagus nerve is your longest cranial nerve. And he found that we as individuals have the capacity, we have the ability to do certain things, do certain body movements that activate different parts of our vagus nerve. And polyvagal exercises are intended to help the individual tap into the parts of the vagus nerve that help regulate our central nervous system. So your automatic nervous system has two parts. It has your parasympathetic nervous system and your sympathetic nervous system. Individuals who struggle with anxiety and even depression in any capacity are often in fight or flight mode. That sympathetic nervous system is just on overdrive. So polyvagal exercises empower the individual to do certain movements to calm themselves, to soothe themselves. And it's an excellent tool because it does not require time, a significant amount of time. It does not require a large investment. These things are easy to remember, and you can essentially do them in multiple settings. So it's a great tool. I'm going to give you a resource that you can research. Her name is Suki Baxter. You can find her on YouTube. Her Suki, Sukie, Baxter, Baxter. She's on YouTube. She does a lot of great video illustrations of the different types of techniques that are out there. My favorite one is the ear one. And I love it because you can do it anywhere. You can do these polyvagal exercises if you're holding your baby, if you're driving a car, if you're in a meeting and nobody knows that you're doing them.
That's very cool.
Yeah, it really is. And one of the hardest things with anxiety is this idea of I have it, I don't like it, and I don't know how to get rid of it. And so this helps empower you to take action, which immediately gives the individual a sense of control, which is important.
Yeah, definitely. I love that.
Check out polyvagal exercises. It's awesome.
Yeah, that's a great tip. Thank you so much for sharing that. I'll definitely post that. So when you go underneath this episode and you look at the description on the left, if you're on Apple, and just directly underneath it on Spotify, I'll have different links, and I'll definitely share the link of the EMDR website and then Suki Baxter. So you guys can check those out and, do those exercises, look and see if there's an EMDR therapist in your area. I think those are great resources. Thanks, Lauren. So as we kind of just wrap up, you've given us a lot of good nuggets, a lot of good information. I think obviously I'm more prone and obviously a little bit more passionate about the postpartum community just because obviously I'm a big part of it now. And so I just wonder, with your postpartum moms and EMDR, non-EMDR, any type of strategy or any advice, what would you give to those moms? Maybe they just had their baby, they're feeling kind of lost, they're not sure which way to go, if they should ask for help, how long to wait, those type of things. I guess, what would you kind of tell those moms?
I would tell them that everything that they are feeling is valid and okay. Mm-hmm. I think there's a lot of shame associated with postpartum depression. Mm-hmm. When you're pregnant, all the discussion is on the baby shower and all that fun stuff. But I don't know about you, but I did not get a lot of information about postpartum parenting. Mm-hmm. So there's this kind of idea of like, okay, now what? You get home and you bring the baby and it's like, oh, okay. Oh, yes. Yeah. Oh, this is real.
Yes.
Okay. There's no nurse coming. Oh, okay. Yep. Just me. Or just me in the sense of we're solely responsible for this little human now.
Yeah.
If you have a partner, talk to them about it. A lot of people hide that because babies are exciting. What do you have to be upset about? These are exciting times, but it's absolutely normal. The amount of hormone changes that occur in that time frame, especially changes to our bodies, mm-hmm. especially if you've had a traumatic birthing experience, all of that can really impact your resiliency in that 6 to 8 weeks after delivery.
Mm-hmm. I love that.
I was just going to say, don't be afraid to reach out and ask for help. Don't be afraid to talk about it. You don't have to slap a smile on your face. And also remember, two things can exist at the same time. The power of and I tell my clients that. A lot of people think, well, if I am upset or crying, it somehow takes away from the joy of having a baby. And it doesn't. Two opposing things can exist at the same time. I can be so excited to start a journey in parenthood, and I can also be so terrified at the same time. Yeah. One does not take away from the other. So give yourself that grace that negative emotions do not negate positive ones.
I love that you said that. I mean, you hit the nail on the head. I think it's so easy. And then when you do start thinking, I can't be upset if I brought home a baby, then that totally takes away, at least for me, I let that take away from the joy and things like that. But I love that you say that because there's so many emotions that are going on. It's overwhelming, it's exciting, it's kind of scary. I mean, it's a mixed bag. So I'm glad that you said that. Now, in your opinion, obviously you have fantastic mental health experience. When you might start seeing a postpartum client for the first time and you're going through the treatment plan and establishing things like that, if you were just thinking about before they came to you, when do you think is a good time for a mom that could potentially be struggling to reach out? Because I think for me personally, I waited a little bit too long. I know I went to the OB and had that addressed, and we trialed some meds and a few other things. But I think maybe if I was aware of what was going on before then, I would have reached out sooner. So I guess in your experience, what do you think about when they should reach out, and if they are having those feelings of maybe the baby blues or something seems a little off?
I would say trust your gut. If you are having a hard time bouncing back from something, or if something doesn't feel right, trust your intuition. Trust your intuition. Enlist the support of loved ones around you and bounce it off of them. But I guess to ultimately answer your question, in terms of functional impairments, if you are to the point where you are struggling to function, I mean, we all struggle to function postpartum, right? We're all sleep deprived, the hormones are dumping. There's a lot that's going on and we're adjusting to our new life. But if you don't feel 100% and you're struggling to bounce back and you're just wanting somebody to talk to, it's okay to reach out for help. So I would say to moms out there, stay on top of it. Trust your intuition. It's a lot easier to manage things proactively as opposed to retroactively.
Mm-hmm.
So a lot of functional impairments. You're just not able to function. You're not able to enjoy the process. Don't feel like you have to keep that all in and wait until things get really bad. My biggest advice would be don't wait until it gets really bad. Stay on top of it. Come in as soon as you start to feel uncomfortable. Mm-hmm. You got to think about your quality of life. And the other thing is when you become a parent, especially if you struggle with putting yourself on the back burner, when we become parents, the idea of putting us first can seem kind of selfish. Mm-hmm. It can seem, oh, no, we got to put our kids first. But you got to take care of you. You have to be proactive. You have to say, wait a minute, I need this in order to be the parent that you want to be.
I love that. It's very true. That was good insight. Thank you. Lauren, I think that was great advice about the postpartum. I think it's very hard because you're trying to do everything for the baby and also maintain yourself and your home and a relationship if you're in it. And so I think that's very good. I think it doesn't hurt to go see a therapist. I don't think there's a too soon. Like I went to the therapist too soon. At least they can give you some good insight, some resources, some information. I think that's great. Thanks.
Yeah.
Yeah. And then something I like to ask all my guests at the very end is I always like to ask, what would you say is one word that you would use to describe your profession or your career so far?
I would say collaborative. So as a therapist, a lot of people come to us thinking that we know all the things. We know some things, but you are the expert on your life. So on this journey, people come to me and trust me, and we work together. And it's a very vulnerable relationship, and it's a privilege to be a part of someone's healing journey.
I love that. That was good. Well, Lauren, I'm just so glad that you were here today. And I know that you gave us so much good insight and we really appreciate it. So thank you for being here.
Thank you for inviting me on your show.
Absolutely. And For the listeners that are going to stick with us, Lauren is going to be back, and we are going to be talking on a future episode about discharging from the hospital and what that looks like, and a very awesome therapy resource called an IOP program, which is intensive outpatient therapy. So we are going to address that in our next episode together. So I hope you guys hang with us for that. See you guys soon.